Well, that means it is time to verify direct exposure, quarantine, isolation, fully vaccinated, boosted. All of these terms factor into what to do after coming in close contact with someone with COVID-19. So viewer Brenda reached out asking to verify, does vaccine status dictate whether you quarantine? Does that mean fully vaccinated and boosted before symptoms develop? No quarantine if you've been exposed? And what if you live with someone who likely has Omicron but hasn't received test results back? Should you quarantine even if you are vaccinated and boosted with no symptoms? Well, to verify, I looked at the CDC's isolation and quarantine guidelines updated December 27th, and I talked to Dr. Cynthia Snyder, infectious diseases physician with Cone Health. The answer to both questions is yes. The CDC's new guidance says if you were exposed to someone with COVID and you're unvaccinated or your last vaccine was 6 months ago or longer, you should stay home for 5 days, then continue wearing a mask around others for 5 days. But if you've completed your vaccine series or taken a booster in the last 6 months, you don't have to quarantine. Instead, wear a mask around others for 10 days and test on day 5. The CDC's rules make no mention about what to do if your exposure is within your household. So here's what Dr. Snyder recommends.
Yes, somebody who has somebody who's positive in the household has the greatest risk of converting over and getting the infection, even if you're fully vaccinated. So the guidance I give for folks is to stay home. If you have the capacity to quarantine and stay home, you should.
She also said to test as soon as you find out your partner or child is positive, and if you're negative, retest in 3 to 5 days to make sure. In conclusion, it's true, you don't have to quarantine after direct exposure as long as you are recently fully vaccinated or boosted and have no symptoms. But you should quarantine even if vaccinated and boosted if someone in your house is positive or symptomatic. So all that said, if at any point you develop symptoms, you need to test right away and isolate for 5 days if positive. The CDC says if you have little to no symptoms, you can leave your house after 5 days, but continue masking for an additional 5 days. You can help stop the spread of misinformation. If you see a claim or a story that needs to be verified, send a selfie video or short paragraph to verify@WFMY.com.